Welcome to Startup Health TV. This is where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster, and I am privileged to be here today with Vijay from Tomorrow Health.
It's great to be here with you, Logan.
Great to have you with us. I want to start by just level setting on what Tomorrow Health is building.
Absolutely. At Tomorrow Health, we provide technology to coordinate the way that home-based healthcare is ordered, delivered, and paid for. We work with a range of health plans at the national and regional level, as well as tens of thousands of hospital systems and provider groups to make more seamless the way that home-based care is delivered for the members that they serve. We serve members that are recovering from post-acute healthcare episodes, as well as those that are managing ongoing chronic conditions.
Okay. What do you feel like is your greatest distinguishing mark in the market right now?
You know, I think we have approached a space in home-based care that no doubt is a meaningful growth area for the care delivery ecosystem, but also has some substantial problems. It has a deeply fragmented ecosystem of providers. There is a tremendous amount of inefficiency as it relates to the administrative workflows that govern how providers are selected to deliver care for members, how providers are able to actually deliver care at high quality and high levels of efficiency. And we've been able to build purpose-built technology for multiple stakeholders to really improve that process end to end. And some of the things we're prouder of are that we've been able to deliver 97% on-time starts of care for the patients that we've worked with, a 95 patient NPS score in a space where the network average is typically around 10. And an over 3.4x financial ROI for the health plans and risk-bearing organizations that we work with.
I was going to ask, I think you just answered it, kind of why you have been successful in raising funds, getting the attention of the industry. It sounds like you proved out these metrics first, and it has really gotten people's attention.
I think it's a couple of different things. One, it's a big space and a big set of problems, right? Today, 1 out of 4 Americans receive some form of care at home, and we expect that number to significantly increase. And yet, 72% of folks report significant difficulty in getting the medical equipment, supplies, or clinical services that they need. There's over $250 billion spent annually on home-based care, and yet the quality standards are very low. So it's a big problem, and I think that's one of the first elements. I think the second, to your point, is we've been able to build a solution that has the ability to scale. So with many of the national health plans that we work with, we start working in 1 or 2 states and then have the capability to span that across the full breadth of their membership. And we're serving today across our population millions of patients and families across the insurers that we work with. And the third is those proven outcomes, right? And actually being able to deliver real tangible results, both in terms of quality outcomes, but also in real actuarial approved cost savings for our partners.
Awesome. So part of the reason why we're having this conversation is that you were in this session about working with Medicaid, and it's something that I know Tomorrow Health has done, and something we want to explore is proven strategies for startups that want to break into that world and have a strong positive impact in the Medicaid market. So it's something that you've done, and I'm curious what advice you might give to a startup that's pitching, thinking about having that kind of Medicaid impact.
Yeah. The first thing I'll say is it is amazing in this morning's session and more broadly to just see the amount and breadth of innovation that's being focused on the Medicaid space. I think relative to other areas like Medicare Advantage, it has historically been a vertical that's been underserved by innovation. And with, of course, now over 90 million Americans served by Medicaid, it's just a huge area where we need more innovation, and there's the potential for tremendous impact. In terms of advice and navigating it, I think I'd say a couple things. The first is that operating in Medicaid requires a very bespoke approach, depending on the state and the plan that you're working with.
Sure.
Right? Half of the Medicare benefit is covered and administered by state budgets, and so there is variance across states based on the nature of those benefits and also how they work with potential innovative companies. Generally speaking, most companies find it much easier to work with a managed care MCO private health insurer managing the Medicaid benefit as opposed to with the state Medicaid departments directly. And what we have found is important as part of that process is, one, identifying your champions early. For us, that tends to be clinical leadership, network leadership, as well as some folks on the financial and actuarial side. Be clear about the metrics that those plans care about relative to the vertical in which you operate. What are they including in their RFP bids to the state? What are the areas where they have set broader strategic goals and targets around? And be very clear about how your business can impact those metrics. And the third is be patient. These processes take time, sales cycles are long, but working with these organizations provides the opportunity to serve some of the most underserved patients and families across the country and to drive a tremendous amount of impact.
Do you see Tomorrow Health's strategy evolving, changing as the Medicaid population changes? I know we had this 3-year period where we didn't redetermine who was in Medicaid, and now we're sort of reassessing who this patient is, and the profile is shifting.
Yeah.
And I'm curious how you see that affecting the work that you're doing.
Yeah. Medicaid and serving Medicaid patients has always been a core part of our strategy. We serve today all lines of business, so managed Medicaid, Medicare Advantage, and commercial. But we have seen really meaningful resonance with many Medicaid MCOs that are navigating some of the unique challenges predicated by the lapsing of the PHE and redetermination that are being driven by the exacerbation of many underlying condition areas and the shift in the overarching care delivery landscape towards alternate settings of care like the home. And so that's an area in which we've seen the opportunity to really work hand in hand with many of these plans to bring purpose-built solutions to help them solve some of these challenges now on an ongoing basis. And I do expect that as a business, Tomorrow Health will continue to be doing more and more work with Medicaid partners and Medicaid patients going forward.
When you think about care in the home, are there technologies that really get you excited when you think about, hey, if we really rethink the home as a place of care, what are the ways in which we can really wrap around the patient with biometrics, ways of understanding who you are?
Yeah.
So what gets you excited about the technology behind home-based care?
Yeah. Well, I think if you look at the full home-based care ecosystem and the continuum of patient getting served, there's an opportunity for innovation at each stage. So in the way home-based care is ordered, streamlining and digitizing what is often a very long, bloated administrative process to identify the right provider and get them the right information to serve a patient. Navigating through a myriad of clinical quality and efficiency data to identify the highest value provider, and then streamlining the way that care is delivered through avenues like remote patient monitoring technology, streamlining workflows and billing challenges, and ultimately resetting the incentives in the ecosystem such that providers are oriented towards delivering higher quality and more efficient care. And those are some of the shifts we've seen that have driven some of the biggest impacts in the home. And ultimately, we want patients to remain healthy and safe at home longer, and to prevent them from having to come back to the hospital or other types of care settings. And those are some of the areas where we believe innovation can be most impactful.
What would you like to see? I don't know if you get pitched by startups that are tackling sort of niche problems in the home care market. What would you like to see pitched to Tomorrow Health? What innovation would you like to see presented here that would really help this patient population?
Yeah. I think there is a range of solutions that can be really valuable and complementary to the work that we're doing. I think there is a lot of burgeoning innovation in the remote patient monitoring space, and combining that with some of these new and advanced care models towards hospital at home, I think has real and meaningful promise. I think the biggest thing across the breadth of these solutions that I would push companies to think about is interoperability, because our goal in the home is to take something that has been otherwise very fragmented and disjointed and to translate that into an experience that's much more seamless and coordinated. And so as we work with partners, and we have a number of partners across our ecosystem, that's one of the things that we focus on, is what are those opportunities to plug in seamlessly to our platform and the platforms of our partners in a way that is less disjointed more seamless, and democratizes a lot of the data visibility that's necessary to coordinating care effectively for these patients.
I love it, Vijay. Thanks for taking the time with me today. I appreciate hearing the update on Tomorrow Health. It sounds like you guys are growing fast, and we'll be watching your progress going forward.
Thanks so much. It's been a pleasure to be here.
All right, take care.